Hey everybody, Amir here. I'm out getting some exercise and movement in today. We're rucking, carrying about 35 pounds, not too heavy, but getting good movement nonetheless. Today I want to talk to you about something though. It's called metabolic syndrome, and it affects 1 in 3 adults here in the US, and in our practice at the store, we see this only getting worse. And it's not a specific disease state, but rather a collection of risk factors that increase your risk for heart disease, stroke, cancer, and dementia. Doctors typically will look at 5 main categories. First is belly fat. For men, a waist over 40 inches, and for women, a waist over 35 inches. They'll look at triglycerides if they're over 150, or if you take medications. If you have low good cholesterol, so that's like under 40 for men or under 50 for women, or if you take meds for it. If your blood pressure is high, like over 130 over 85, or if you take meds, or if you have high blood sugar or take medications for diabetes. These are the risk factors that make up metabolic syndrome. And if you have 3 or more of these, technically you have metabolic syndrome. Now, why is that important? It puts you at a much higher risk of serious health problems. If we look at the heart disease, right, you're 135% more likely to have heart disease. Your risk of heart attack in the next year nearly doubles. Your risk of stroke is up 127%, and dying from any health-related cause in the next year is up almost 60%. Chances are much higher of getting cancer. I think it's 56% higher. And these aren't just numbers, right? It's personal. And I'm not a metabolic syndrome expert, but I'm somebody who's about to turn 42. I want to be sure that I'm there for my kids, for my wife, to enjoy the experiences that we want to enjoy in life. And metabolic syndrome is probably the number one thing that is driving a majority of disease here in the United States. So my ask is know your numbers, know your risk factors, right? Most of these are easily obtainable. You can measure your waist, right? You can measure your blood pressure. Come on down to the store. Most of us have blood work. We can look at our cholesterol panel. We can look at our A1C level and really determine where we are. The number one thing we have to do to fix the problem is to know that we have a problem in the first place. So I want to encourage you, get with your healthcare provider, check your numbers, know where you're at. This is a huge deal. In the upcoming months, we're going to be talking with a lot of different healthcare experts who know way more about metabolic syndrome and how to treat and prevent it than I do. And I'll be bringing all that information to you. Until next time, from everybody down here at Perkins, have a good day.